Welcome to Adapting class. Anticholinergic pharmacology is very important for your boards. They like to ask questions about it, safety, teaching, education, risk management. So let me give you the content related to that. Short video you will never forget. Straightforward information as usual. What is it? They block, what is the problem? They block cholinergic effect. So they block acetylcholine. In the process, that leads to what? Certain things you have to know. These are the ones that I want you to pay attention because um, pupillary dilatation. In the process, you're going to cause blurred vision. This is one side effect they always ask. Second, is going to lead to decreased secretion. Okay, if it lead to decreased secretion, you're going to have dry mouth. So dry mouth. Right? You're going to have constipation. Side effect, you're going to have urinary retention, another major side effect. The third one, a decrease parasympathetic nervous system. In the process, it can lead to tachycardia or arrhythmia. Right? So that's another key fact. Number four is going to relax smooth muscles. This has a lot of effect. It can cause vasodilation, right? And therefore, this will decrease sweat. So the individual cannot make sweat. In the process, if you decrease your sweat, you're going to have hypothermia. So they have hypothermia. They're very, very hot, but they can make sweat, right? They overeat. In the process, the skin get flushed, flush skin, right? Those are side effects you see in the question. So flush skin as much as possible. And so these are things you have to know. And the last one is fifth. And the fifth one is like in elderly patient, you got to be careful. It can lead to confusion. It can lead to fall. It can lead to orthostatic hypotension. So this is what you see. They said you can pee, right? You can see, you can spit, you can poop. This is the problem with anticholinergic. You have to know some few medication that so that when they ask you, the common one is atropine. Atropine is used for symptomatic bradycardia, not just bradycardia. So if you have bradycardia and you have symptoms, atropine can be used for. It can also be used for to decrease secretion, right? During surgery, or somebody is dying and he has a lot of what we call the rattle smell, right? When they are about to die, they have something we call rattle sound. They're about to die and they make sounds as they breathe. Uh, This is due to excessive secretion. You can give them atropine. Scopolamine is one medication. This is used for nausea. At the same time, it can use for motion sickness. It can also, but it has a side effect. It can cause extrapyramidal side effects, so you got to watch for it. In the respiratory, these are the what we can use as a bronchodilator. Ipatropine and tiotropium. You see, they look like anticholinergic. You can use it in COPD. They look like atropine or asthma patient. And they can, especially ipatropine, you can use it in acute situation. In the bladder, if your bladder is moving too fast, you can use anticholinergic. We use um, osibutanin. This can also be used. This is what we call ditropan or toluridone. This is what we call Detro. So we use it for overactive bladder, or somebody would say incontinence. urinary incontinence, basically to slow down your bladder. In another medication that I want you to pay attention to is benztropine or trihexyphenidyl. These can be used in Parkinson's disease because for the anticholinergic effect, we can use this medication for that, or we can use it to treat extrapyramidal side effect. Very, very important. So watch for that. And the last one is dicyclomine. This is IBS. If you have IBS, we can give you this to help with that. So these are really good anticholinergic I want you to be familiar with. Of course, they're going to ask you contraindication. And what is that? If you have glaucoma, you cannot take it. If you have BPH, just flip the information I give you here. You just flip it. You don't have to memorize. You know these are the side effects. Therefore, you flip it. If you have BPH, urinary retention, you cannot have it. If you have obstruction, you cannot have it. If you have tachycardia or tachyarrhythmia, or I would say arrhythmia, you cannot have it, or you should be careful of it because it can lead to bad side effects. What are the nursing intervention that you should teach the patient or you should use when you're taking care of this patient? Void before you give them the medication. Let them void first. Give them sugar-free candy or hard candy to wet their mouth. Let them increase their fluid intake to prevent constipation. They should avoid overeating, right? Overeating can become a problem, and be cautious when the patient is an elderly patient. What is the antidote? You can use a cholesterol inhibitors. So antidote is the stigmine. So if you have neostigmine, if you know how to treat myasthenia gravis, the same thing. Myasthenia gravis lack acetylcholine due to antibodies. The same thing. When you block all your acetylcholine, you will need more acetylcholine. So neostigmine, physiostigmine can give you more anticholinergic effect to counteract the anticholinergic. These are the things you need to know for this medication. Very short, high yield fact, no example of them, contraindication, risk management question. Take care of yourself, and thank you.